Youth from various universities and schools, in partnership with civil society organizations, constituted themselves into parliamentarians for a mock plenary sitting to discuss the way forward for menstrual health care in Uganda. The Youth Mock Parliament on Menstrual Hygiene Management was chaired by Takali Betty, a law student at Uganda Christian University.
We have the structures, let's say UNSA, let's say the National Youth Council, and the people within these structures can actually take the mandate or the responsibility to carry out education. Because when you look at things like stigma, where boys laugh at girls because they're in their menstruation, it's because they do not have the information.
The debate sought solutions to the increasing school dropout rates among girls resulting from menstrual hygiene challenges. Participants amplified calls for action against stigma and discrimination faced by girls and women during menstruation.
The statistics from the study say that 61.7% of girls miss school during menstruation. And that's an alarm for us. If we want to achieve the NDP4 objectives.
A section of members of parliament who attended the Youth Mock Parliament plenary pledged to lobby the 12th Parliament to prioritize increased budget allocations for menstrual hygiene management.
My take home should be that we should have reusable pads that are not going to affect the environment, because we are dumping everywhere. Like now these days, the young ones, we have these Pampers. Pampers. I don't know where they are. Are they recycling them? Where do they go? I'm talking of science, technology, and innovation. All these things are affecting the environment.
The challenge remains more prevalent in rural areas where many families are battling poverty and parents are forced to choose between buying food and providing menstrual hygiene products for their children.
So generally we are seeing that the price for sanitary pads is a bit high compared to the average earnings of families. These sanitary pads cost, the list is 3,500. It goes up to 10,000, and you find that most families cannot afford that.
Then would also like to make recommendations to the different departments which are directly into this implementation. The education sector. Prioritize the menstrual health management as part of your curriculum. Foster the students, especially at the puberty stage. They should be fostered with knowledge, empowered about menstrual hygiene.
Mondo Chateka, the Commissioner for Youth and Children Affairs at the Ministry of Gender, Labour and Social Development, said government programs aimed at boosting household incomes, such as the parish development model, could strengthen families' financial capacity to provide menstrual hygiene products.
2050, Africa will be home to 2.5 billion human beings, majority of whom are the girl children. And so when we are talking about NDP4 and we are prioritizing human capital development, we cannot talk about human capital development with high levels of young girls dropping out of school.
Stakeholders have called on government to establish a national policy on menstrual hygiene and related health services to improve service delivery and keep young girls in school.
So I implore my colleague who's coming in the 12th Parliament, a policy should be developed on this so that our children, our women, our mothers are all safe and they are able to do productive work.
Good morning, everyone.